Hi everybody. Just want to introduce myself. My name is Jamie and I have Sjogren's Disease along with Raynaud's disease. And the purpose of this channel is to sort of open a communication between anybody and everybody that has Sjogren's, lupus, or any other autoimmune disease. Autoimmune diseases are just a newer disease that we don't really know that much about. I've been studying and researching for years, and this is the new Sjogren's edition 5, Sjogren's book, and even my rheumatologist said don't even bother trying to understand it. I thought that was not great advice. However, I think his point was we don't even understand what it is as rheumatologists. I mean, 20 years ago, nobody was even diagnosed or couldn't be diagnosed. So it's a mysterious disease. What's crazy about it is it's the number 2 autoimmune disease. Rheumatoid arthritis is number 1, yet very little research has been done on Sjogren's. Sjogren's patients and rheumatologists and healthcare professionals rely on research via lupus. And even though it is a sister disease, there's a lot of overlapping similarities, and they're treated exactly the same, meaning the drugs that are used, the medications that are used to treat lupus are the same medications used to treat Sjogren's. So why isn't there much research or talk of Sjogren's? Why does the general population not know about it? I don't know. But I do think we should change that. At first when I found out I had Sjogren's, I looked up and I thought an autoimmune disease, okay, all right, whatever that is. I had known people with lupus, but I just thought it meant when they got sicker than most people. I didn't really know much about it. Initially, when I looked it up, it was dry eyes, dry mouth, dry skin. And I thought, oh, okay, that doesn't really sound that terrible, but that is just like the icing on the cake. It's like the one way to describe Sjogren's above and beyond any other autoimmune disease. So this episode is just going to be what is Sjogren's. And as we go along, I want to bring up other topics and talk more about ailments and how Sjogren's affects our lives and how we can sort of deal with it together, and hopefully share research and things that might help us. And in the comments, feel free to add anything. This isn't medical advice. This channel will never be about medical advice, just my personal experience, what I've researched, what I've studied. I am doing this, obviously there's not going to be a big following for Sjogren's disease, but I know like my mom is too old to research, and her brain fog and the things that she deals with her autoimmune disease, she can't research these topics and books. And some people get very overwhelmed, and some people just rather listen to their doctor, but I just think there's more to talk about than the 15 minutes our rheumatologist gives us every 6 months. And even then, rheumatologists can't really, all the healthcare professionals aren't aligned when it comes to Sjogren. So let's talk about it. So we know it's an autoimmune disease. We know that. I'm going to be looking down a little bit just to make sure I don't say anything wrong. And if I do say anything wrong, you want to correct me, feel free to leave it in the comments. I'm no master at this. I just have spent a lot of time trying to understand it. Even though my rheumatologist said no, I'm going to. Okay, so it is a rheumatic disease, and this is characterized by our lymphocytic. It means inflammation, right? So this is the inflammation of mainly the exocrine, which is the gland, which is the moisture gland. So that's why it's most characterized by dry eyes, dry mouth, dry nose, dry skin, dry everything. However, only 80% actually experience what they call sicca, which means dry. When my rheumatologist and doctor asked me, do you have dry eyes or dry mouth? I was like, I've only ever lived in my body. I don't know, because I'm not the person that has to use, or at least not yet, since there's gradual onset with the disease, I don't have to use eye drops 10 times a day. My eyelids do not stick to my eyeballs. I dry mouth. I thought, oh, dude, I don't know. Do I have dry mouth? And then when I started listening to other people, I was like, oh, I do have dry mouth. I'm obsessed with water to the point where I have to have it with me at all times. And if I get in the car and I don't have my water with me, or get somewhere and I don't have water with me, I start to do a little, have a little anxiety and panic. So I guess my entire life I've had it, but I just sort of, like with all ailments, you find ways to adapt. Not even realizing that that's what I was doing. Same with like my Raynaud's. I just thought I had cold feet. Everyone in my family has cold feet, but come to find out, a lot of the women in my family also have Sjogren. So we're going to talk about that too, because it's very confusing that it's not genetic, but that it runs in families. That's a topic for another day. So we know it's autoimmune. We know it's rheumatic. So dry eyes, dry mouth, and it can have inflammation of internal organs. Luckily, I guess this is our lucky part, is that lupus, you see a lot more attacking of the internal organs, where with Sjogren's, it's a lot more rare. So typically our lifespan isn't shortened necessarily with Sjogren's, unlike my mom, who had pan disease that attacked her bowels and internal organs, and that could be very dangerous. So I guess we're lucky there. I don't know. We know it's an autoimmune disease because the antibodies go against certain components. So our lymphocytes, our white blood cells, attack our exocrine gland. That is sort of the main defining part of Sjogren's disease. It is rheumatic. And what that means is it frequently causes musculoskeletal pain, as well as arthritis, joint pain, swelling, muscle pain, fatigue. I just thought I was lazy when it came to the fatigue. Everyone else wanted to hike. I don't want to hike. People want to go walk a marathon. I don't want to do that. I've never really wanted to use my muscles. It's painful, and I suffered so much pain throughout the decades in my shoulder. I thought it was from being a professional wedding photographer and, holding this camera up for 8 or 10 hours a day for a decade, and just excruciating pain in my muscles. And the first time I saw my rheumatologist, he said, do you have pain in your shoulder? And I said, how do you know that? I didn't write it down. So I was very confused. And he said, most of my patients have muscular pain. I'm luckily do not have joint pain, but I know that's sort of a top ailment. So it's the dryness is kind of sometimes can be the easier part of our disease, even though it's the most defining. I mean, the fatigue and the joint pain and the muscular pain is actually really the debilitating part. I mean, if you get flare-ups, sometimes you can't get out of bed. Sometimes you can't get off the couch. You can't do much. And it's really hard for outsiders to understand because we don't wear our disease necessarily. You look at us and we can look healthy, but why do we struggle to get out of bed every day? It's hard. So, and also it takes 3 to 5 years for the average person to get diagnosed. It's so crazy. Why? A lot of it is because the physicians do not agree. It can make it really difficult to get a diagnosis. So I was one of the lucky ones that got it right away. But at most my mom they put, these things in her eyelids, to test her eyes. And I thought, oh, you're not doing that to me. A lot of people have to get lip biopsies and their lips swell. And it's horrible. I mean, I'm just so lucky. it was right there. It was right on the first test. I've been questioned a few times. I haven't been told I don't have it, which many of you have, which is frustrating because when you do, you do. If you're on these groups on Facebook and you've done a lot of reading and research, and if you get an ANA and it's positive and they just don't know which one, and I mean, it's not rocket science, even though it's mysterious, we don't know a lot. We're certainly going to try to find out together. So please, if you have anything to add in any of my videos, drop it in the comments. If you disagree with something I say, or you have something to add, or you want to put a research topic out there, if you have any suggestions for me, please leave it in the comments. And I really hope together we can understand this disease better. And I will see you next time. We're going to talk about the top 10 ailments and what those look like on a daily basis, not just the bullet points of what those are, which was very confusing for me. So yeah, let's dive into what Sjogren's is and let's see what we can do about it. Take care.